development.
I thank the Assistant Minister and I call the Minister for Holt.
Oh, thank you.
Oh, the member for Holt,
That's
sorry.
a promotion. I'll accept that. Thank you, Deputy Speaker, and I gratefully accept the promotion. Deputy Speaker, I rise today to discuss an issue that concerns us all in the community, and that's the and I speak of it particularly post the publishing of the 2014 ABS statistics reporting that the suicide rate in this country had increased to 2,864 deaths in 2014. Now, census data in my electorate and around the surrounding region indicates that we have around 60,000 young people who live in the city of Casey. One of the key issues for them is the issue of mental health. When Labor was last in government, we established the funding for Headspace Dandenong and Headspace Narre Warren to ensure that Casey youth had access to local mental health services. We'd had some challenges there, Deputy Speaker, and I was very proud of the way the community came together to deal with those challenges in a collective way. It's also why I'm a huge supporter of the Australians for Mental Health campaign, which I had the privilege of launching with Professor Pat McGorry, Australian of the Year in 2010, in 2014. Around half of all Australians will experience some form of mental ill health during their lifetime. Less than half of these people will access treatment. Every day, 7 Australians take their own lives. 200 attempt to. That's more than 2,500 people lost to this country through suicide every year. Suicide is a leading cause of death for Australians aged 15 to 44. Mental ill health strikes in the prime productive years of life, taking Australians out of work and ending our economic health. Recovery from or living productively with mental ill health is possible. Australians should have hope of recovery, and that comes with a first-class mental health system. Now, Deputy Speaker, despite accounting for 13% of the total health burden of disease in Australia, currently and for some period of time, only 7% of government health expenditure is directed towards mental health. We actually have third world levels of expenditure and of all governments on mental health, and that should be of great concern to all Australians. And that's being apolitical. It's not targeting government, it's attacking governments since the institutionalisation of mental health care occurred post-1993. Just $10 billion is contributed to mental health care annually. Mental health care costs the Australian community $40 billion, so there's a cost-benefit analysis in this as to why governments need to spend more in terms of mental health. We do need to substantially increase the funding to deal with, as you see on the sharp end, the increased suicide rate, which is a great concern because it should be going down, not going up. Just locally, we have 2 fantastic Headspaces, but again, they're having to retender for their services. If you're going to provide facilities, you need to give them continuity of tenure, and assurance of continuity of service. We need to increase funding, we need to provide the security for funding, because mental health should be